Hello,
We're back again.
he's Shabazz,
Here's Pete Marshall, and this is Crib Chat UK.
and what are we talking about today?
Uh, Manchester versus uh, Manchester versus Westminster. Sorry.
Exactly, we're talking about because we're in Manchester. Um, yes, we're going to be under tier 3 lockdown
Tomorrow.
tomorrow. Yes, and so Andy Burnham has been fighting with Boris Johnson about how much money and kind of what remediations are going to be in place and who's going to pay for them and all of that jazz.
And as a result of that, they have now got some sort of settlement. We won't get into the numbers because they might not be correct, or it is boring. So
And honestly, the predominantly because the government has basically, we're recording this on Thursday, and so literally like most of these numbers only came out this morning. And honestly, it's been a complete and the government has been they've been very opaque about the numbers. And so at this point, like the day before yesterday, Tuesday, there was an entire thing where Manchester would only be getting 22 million. And then the next day, Boris Johnson stood up in Parliament, was like, we're getting 65 million. And honestly,
Well, hang on, I've just said we're not going to go into the numbers, and you start going into numbers.
yeah, I'm demonstrating the point.
Yes,
It all ends up being fairly meaningless,
yeah,
especially as Russia Sunak's like basically large amounts of the argument that Andy Burnham was making has essentially been made. Essentially, Andy Burnham was like Andy Burnham was just completely kept out of the room, and they ended up and Russia Sunak ended up announcing all of it today anyway, and everyone is completely befuddled. So yes, um,
Richie Sunak being the Chancellor of the Exchequer, for those people who don't know,
yeah,
for people in this country and around the world, because we're well aware that we're being listened to, thankfully, around the world. And
it's slightly a bizarre feeling, honestly, but
yeah,
yeah,
but,
it's very
but
nice. Yeah,
yeah, but we just go with it. But we want to make sure that people are aware of what's actually going on from a disabled perspective. And we've had a very busy week this week, and hopefully we'll be able to give you some very useful information today.
I mean, honestly, I think most of the useful stuff today will actually not be will actually be about stuff that was kind of missed out in the entire negotiations, and that's kind of the mutual aid groups.
Yeah,
Because
and for the people who don't know what they are, could you, if you don't mind, give us a brief outline
okay,
of what a mutual aid group is?
for those of my friends who are kind of communist slash anarchist, I know will be gritting their teeth because these things have been one of the more formal ways of those groups kind of actually doing stuff for like 20 odd years. They're basically it's kind of a black bloc kind of thing. But for the rest of us, um, basically mutual aid groups kind of sprang up. And again, this at the start of the first wave, and they alongside a whole bunch of funding, which is in order to allow people with shielding to get food delivered at home and to basically act as kind of poverty remediation to help people with mental health. Basically, they do a whole bunch of really useful stuff to whilst coronavirus is raging to basically allow people to get on with their lives.
So would you say, in effect, they're like first responders?
Yes, in the context we're talking about them, yeah. I mean, largely they're untrained, which has its own set of problems. I would also say that one of the biggest problems is, especially around mental health, is the fact that really the problem is I think much of the time the problem was implied to be like, oh, if you just talk to people, then things will be fine. And in the end, I don't think that's actually a useful solution. And honestly, and I mean, it's its own like 160-hour long conversation because I think fundamentally the problem is living in times like this, and the problem is a whole bunch of things from the way time feels to the fact that people can't like plan for the future as effectively to the fact that they can't the fact that with furlough and a whole bunch of things like various people's careers are basically like hit a brick wall. So I think and that's not counting people who've actually lost money, that's not counting people who have been relying on going out for drinks with friends, and now that's completely impossible or largely impossible. So I think honestly that conversation has not actually been had as for how do you replace things that were considered to be irreplaceable. And so they have their limitations. But without them, like the first wave would have been a lot worse, and especially for people who were shielding, and especially for people who, um, yeah, for people who needed them, they were really vital. Um,
And are we saying that in this, I don't know whether second wave is the correct term, but are we saying in this second phase, are we saying that that money isn't there?
I haven't seen it, and honestly, there's been a great deal of discussion about. I mean, if you look at what numbers we do have, then then I haven't seen any of that money for kind of mutual aid or community or that lot.
Yeah.
It's also worth pointing out that councils were paying large amounts of that money, and I haven't. And honestly, councils have very little money left. B, many of the funding organisations that were doing it basically like spent a great deal of money in the first wave and now don't have that much. And I mean, in terms of how we, and so in terms of like so basically I don't think there's anybody else apart from the government who could at this point conceivably like be giving the money.
So what do we think the government should be doing? For example, I've not seen a much of a big deal made of people a shielding group this time around at
Yeah.
the moment. Shielding doesn't seem to be an official thing anymore.
Isn't it isn't it's kind of
Yeah, but that's the
Schrodinger's
thing.
shielding,
Yeah,
which yeah, I agree. It's there needs like given that group of the community need to shield
yeah,
and and a large section of the disabled community need to shield.
yeah,
If we're talking about disability policy during coronavirus, a large amount of what we're talking about is what is effective shielding. How do you do that from a day-to-day basis, and what conceivable limitations are there? And
yeah,
actually, mutual aid groups um, are a large amounts of the answer to those questions.
yeah.
Honestly,
And for people listening outside of the UK, we want this to be, well, I want this to be a kind of like be careful what you do kind of thing, you know. like, please learn from our mistakes, our government's mistakes, really. And like, just because people thought about them as shielding people in the first wave doesn't mean that those people have disappeared in
Mm.
the second time round. So we need to, in my opinion, have the same sort of level of support as we did in the first round. And even in the first round, it wasn't fantastic.
Yeah,
People were still going hungry because they just couldn't go out to the shop and they couldn't get money to people to get them to get the stuff. For example, some people didn't have bank accounts and things like that. And what makes me really angry is everybody, without even being a scientist, everybody always knows that the possibility of a second round of this would the likelihood is that it would happen. So the lack of preparation for the second time is even more unforgivable than the first time round. Because you know something's coming. You know what it's gonna be like. So
and I mean, I think this um, kind of leads us to another thing, which Amnesty International have just put out today, and I, from what I can work out, this statement has limitations. Um, but basically they're talking about actually something that we've been talking about, the entire situation around care homes and discharging people with discharging people who potentially have or have not got tested for coronavirus into care homes, and they're raising the red flag on this. And I think what they're saying, from what I can work out, has limitations, because I think the government has just, very just started opening up a set of care homes which are specifically for people who are coming out of hospital, which which I suppose is something like what would have to happen, what should happen. And this particular report doesn't talk about it, but in the end, whether that means that this particular policy is not complete, or whether it means that we are, or whether it means that there's some discharge happening in the shadows, or yeah.
but it's like that's a definition of like what politicians always say is like lessons need to be learned, and this demonstrates again that lessons haven't been learned, and like because we're still gonna have the cow problem, and it beggars belief, really. To be honest, it's like, okay, you caught unaware the first time, but what about the second time? You know, it's
I
sorry, go on.
I haven't seen any governmental announcements around this.
No,
I'm quite curious about that, because you would have thought that they would at the very least say it's untrue, which again, I'm not sure I believe them, to be perfectly frank. But having said that, like, you expect them to say something. Um
yeah,
Honestly, yeah. Hmm.
maybe they're hoping that people will be just too like caught up in the chaos of it all to kind of worry about whether the government have come out and said, well, this is actually true.
I mean, and I mean, there is. I mean, right now in the UK, there is a distinct element of all this where it's either disaster capitalism or just plain like that even the government doesn't actually have any control over the entire thing. And I'm not sure which one of those is more charitable and
Yeah.
which one of those is more accurate. Um, I mean, honestly, today one of Boris Johnson's ministers quit because of a vote that happened yesterday, largely led by the Conservative Party, to basically let um, not fund a program to feed hungry children.
which could I just say was led by a professional footballer, a Manchester United professional footballer who who he campaigned for it months ago for the in the first round, and he got some money for the summer holidays. And what he was trying to do was make sure they got paid, make sure they got food over half term. That's what it was about.
I mean, he's the most
And
public figure in this.
yeah,
Yeah, but um,
because he did manage one way or the other to secure uh, uh, funding for them to get meals over the summer holidays.
I mean, it's worth pointing out that the Labour Party have consistently supported this, and therefore Keir Starmer has consistently supported this. And I realise
Yeah,
in the UK, one of the more fascinating things, and again, partly this is an element of Keir Starmer's personality that he really doesn't like being in the limelight and in the centre of things. In some ways, being a leader, that's a serious deficit. But in other ways, I think to some degree, the population needs to just accept that about him to some degree. And, for example, it was Labour that put forward the vote yesterday. It was Labour that consistently pushed this. So, and to be fair, SNP and loads of and all of the other British parties. So, I think they're saying like it was a footballer that like spearheaded this thing. Well, he was the person that the media loved talking about, and he was the most vocal person on Twitter about this. But honestly, like it wasn't like him versus the entire establishment versus
no, I'm not trying to
again,
paint that.
to be fair, I think the media would probably agree with like the media thing would probably say that, but it's not actually true.
Yeah, but I'm not saying that. But I'm
Hmm.
not saying, I'm not, uh, I'm not trying to give the Labour Party props either. You know,
I
I'm not.
mean, to be fair, like feeding hungry children is like a very low bar. Like
Yeah,
honestly, like to be like we have a left wing party that's prepared to not let children starve. Like that would like that's not really a left wing party at that level.
yeah,
And if that was all, so I'm not really giving them props. But having said that, like it's true. Like whether you like or don't like the Labour Party, like they do actually like walk comfortably over that particular bar.
yeah.
Um,
And just to point out that this bill did not pass by a majority of over 60.
entirely from the Conservative Party.
Yeah. So, I thought that was worth pointing out as well. So it wasn't even close, is what I'm saying.
Again, entirely from the Conservative Party.
Yeah. But but it just goes to show, like, again, that we had a problem with school children in the summer holidays, and in the second time round they haven't learned any lessons, and said, "Oh, forget it this time round. We were generous to the first time round. We won't do it the second time round." You know.
I think
Oh,
I think there's an interesting point that I think the first round again I think there was a almost like spiritual belief. And to be fair, you find that I think this is a largely international thing, and it was based on no kind of academic or intellectual considerations. There was a thing where like this was like that this would happen once and then it would just disappear in a puff of smoke, and all we had to do was be really nice and kind this once. And I think there was also this entire point that I think that there was a that that a lot of people believed that this was or seemed to there was a distinct vibe about um about the important point was the emotion, the feeling, which
Yeah,
again was its own set of problems because honestly, the important point was about doing stuff which requires, actual competence as apart from just being lovely. Um, so I think honestly there was an almost religious notion that there would be one wave, and that as long as we kind of emotioned our way through the first wave, then that would be it, and then we could get on with our lives. And again, this was based on nothing. This is, historically, if that did happen, that would be unprecedented. If you listen to analysts, again, you know, it was hardly like restricted information that like the analysts were like, yeah, of course there's going to be more than one wave. It would, we would have to rewrite the laws of physics in order for this not to have one wave. But I mean, I think that this like incredibly like yeah, this incredibly like religious notion has ended up creating a situation in which lots of places, the UK being the UK government being the most relevant ones for us, it ended up just not actually having made the plans and just kind of and not having used its time wisely, honestly.
yeah. So the lesson here being is for people for countries that have done okay the first time round, well, relatively okay. I would say to them, please do what you did first time round and a lot more rather than a lot less. You know, uh, that is the big takeaway for me out of this. You need to do what you did last time and a lot more rather than what you did last time and a lot less. If that makes sense. Uh, yeah,
I would also say that there has that from people who didn't get a harsh time on the first wave, I think there is this distinct there is a slight thing that that means people are kind of immune,
yeah,
or like they're not going to get a strong second wave. And honestly, like it's not predictive. Like let's be perfect. Like honestly, there's it's fascinating going through the analytics and some of the papers on kind of uh, how these things spread. But the short answer is just because it doesn't get you the first time doesn't mean future waves won't. And yeah,
and I know that's a really bleak thing to say, but
a
it's
little bit.
true. We have to live we we have to live in the reality we now face. Uh, we have to now face up to it. Really.
And I think from a disabled perspective, shielding is like I think to some degree the concept of it is quite kind of obvious. I think the practice of it is a lot more kind of it's not easy. Like, and especially from the perspective of like staying healthy and sane,
Yeah.
you know.
Yeah. I'm not. Yeah. I'm not for 1 minute suggesting it's easy for anyone. You know.
But also that implies that there needs to be like actual systems in place to actually go, how do we make sure that this thing goes well?
And
Sorry.
and this is what angers me so much, is because that we've had the first experience and we had a few months where it was relatively low and no systems were put in place to mitigate the second time around. And that is what is criminal to me. That is negligence on a massive industrial scale to me. You know, that's like, oh, we'll deal with it when it comes, but you know it's gonna come. You know, so neither me or Pete doctors or scientists. But I for one would just say to the people that were shielding first time on, just basically do what you've been doing. Yeah, I would say, and yeah, the social isolation and all the other financial implications are there. You know, it's no point denying that they're not there. But you know, I would just say to carry on, do what you're doing, and to hopefully you yourselves as individuals have had the opportunity, the have now got a better network and a better system around yourself as an individual to hopefully make you cope a little bit better.
I mean,
But
actually, it might be an interesting kind of Twitter conversation to be that to talk about kind of how that actually works, and especially if there's going to be less mutual aid this time, that effectively means that people's social networks are going to be most any social networks you have, and any social workers and any care workers are basically going to be
your
most of it.
family,
Yeah, they're going to be the people that will be allowing you to shield. And so I think that there's an interesting discussion there about like what about, okay, so how does that act, so what's the day-to-day living of that, what is the boring bureaucracy of making sure that you're safe and doing all the small things that need to happen.
yeah. And me, Crib Chat's going to be here to help you through it as well. So, and we're going to be helping ourselves through it. Don't forget that, because we're all in the same boat.
Yeah.
You know that's the thing. And to that end, we had a Deepak meeting the other day, and one of the things that came out of that meeting were, you know, was the idea that we collectively thought the best thing to do was to be as prepared as we can. And when we say be as prepared as we can, it's like try and get your shopping in now, for example, in
Well,
preparation.
I think the most precise thing was basically, and again, th- there'll probably be about a week, possibly, that there will still be that basically that loads of the slots that Tesco's and Sainsbury's will have for delivering shopping will be gone in a very short period of time.
Yeah,
So I would advise people to but I would actually like make sure that you have slots for another like 3 or 4 months.
yeah.
Again, see if you could like plan as far ahead as possible, and that way when things get really busy, then you will already know that you already have slots in place, and then you can
But what we're not advocating is we're not telling you to do anything, but we we, we don't want panic buying to. We, we're not telling you to go out to the supermarket today and spend your last tenner.
honestly, like buying like 500 quid's worth of anything is probably not going to be useful, not unless you have somewhere to store it, you know.
Yeah,
Panic buying isn't useful, but in terms of what slots are, is basically like making sure that someone who's doing a delivery in 3 months time, like already has a time that he is going to deliver to you, and that means that in 2.5 months time you could be telling him then what you want him to be delivering, and even if things are insanely busy, which they will almost certainly get, you'll be done, you won't have to worry.
yeah. And without making this even more complicated and more dark, one of the other things we learned yesterday or reminded about was in the UK, we're going to have Brexit in
Oh dear
January.
god.
So what we were discussing was how how that would impact food food supplies as
Well,
well. Sorry, were you going to say something?
apparently it's going to be at its worst in January, February,
Yeah.
which
So
is
so yeah. So the good news is you got like a few weeks or a month or
months
two,
months to be fair. Like,
but the bad news is that it probably is going to get worse before it gets better.
Medication is apparently one of the very specifics that we were told about,
Yeah,
which is great for people who need medication.
yeah.
Um,
And without this being like an advice episode, but one of the other last things I just wanted to say was if you have any other kind of like some symptoms or conditions that you want to get checked out, please do get them checked out. Don't just suffer in silence. Is what I'm saying. You know, badger your GP, badger your doctor, whoever it is. Don't don't let yourself just suffer in silence, and don't say, "Oh, there's a coronavirus. I won't get my chest checked out or my throat or whatever." You know. Does that make sense, Pete? Or not?
yeah, I mean, honestly, there's been a great deal of like news about an increase in people who um have died of various things at home without getting them checked out, which honestly the NHS still is functional,
Yeah,
barely. The NHS still has doctors and they still have nurses and they still have non-coronavirusy things, and as much as there's a whole um and so make it and so yeah, staying alive doesn't just mean not dying of coronavirus, it means
yeah.
not dying of anything else either. So
But like I said at the outset, neither me or Pete are doctors, so we're just trying to look after our listeners and ourselves, and you can just take it as a bit of friendly advice, really, rather than anything else. Because after all, we want as many listeners to be alive to listen as possible, right?
shockingly enough, you would I mean, I still have no idea what Donald Trump's election strategy is, given the fact that he seems to feel that that his own electorate dying of coronavirus apparently isn't a problem.
Yeah,
But you know, I, we don't agree. We wouldn't agree that that is a sensible strategy, at least for our business. So you know,
yeah. I know that's slightly lighter, though. I don't know if this is true, but yesterday I also heard that the U.S. Disability Organization ADAPT barricaded Joe Biden's house uh, in an attempt to get a meeting with him,
oh
and
yeah,
and they managed to get a meeting with him. But I was trying to have a look around. I couldn't find any information on it, so
and
I
just to
don't know
say,
whether.
yeah, if anyone wants to talk to us about that, that sounds really cool. Like,
Yeah,
um,
because like when Deepak had our meeting the other day, we were talking about uh, what what actions we could take. I mean, obviously, we're not going to say on here what we're going to do or not going to do, but there are discussions taking place.
uprising.
Yeah. Well, a slow,
Actually.
gradual.
Well, for civil servants agents, yes, it's slow and gradual. Let's go with that.
And it'll be socially distanced as well.
So yeah, so it's gonna so yes, there's it would yeah, one of our friends was apparently chatting with some people from Adapt who actually did that,
Yeah,
and because apparently Joe Biden has yeah, was refusing to talk to disabled people about various things, which you know I would again, American politics at this point, yeah, nah.
is there anything else we need to say before we, uh, you know, uh, pull the curtain down on this rather grim episode?
I mean, I do think it is worth saying that like Andy Burnham did really well and actually got quite a lot of what he wanted. I mean, basically, like he got 2/3 of the money he originally asked for, and then the next day the government decided that yes, that yes, there needed to be a bolstering of the furlough scheme. So so basically, what I'm saying, I guess, is people, um, especially mayors of metro areas, like actually getting in the government's face works. So
Yeah, well, but I don't want to be quite as generous as that. But you know, but we are individuals, and and that way we shall remain. But but I don't like the divide and rule kind of thing because I don't know if people know Steve Rotherham, the Liverpool mayor,
mm,
and the government were kind of constantly mentioning him in one of their press and kind of singling out Andy Burnham for being a kind of troublemaker. I don't, I didn't like that whole aspect of it. But that's just politics, I suppose. But it just seems rather filthy at this particular time. And 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 on Andy Burnham, I just he's done a good job. But I just don't like the way people get carried away. Like loads of people are calling him the king of the north, and I do not. I categorically do not subscribe to that view. I do not think
well,
he
to
is
be
the
fair, he hasn't had a coronation in any case. So he hasn't had to put on a silly robe, and he hasn't got a very expensive
yeah.
hat. So
He is, in my opinion, not the king of the north.
well, also legally and constitutionally not the
Yeah.
king of the north. But
But he got us some more money, That 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 will hopefully save lives. So
yeah.
that is essentially, at the end of the day, that is essentially what we want to achieve. So when
Yeah,
we talk
and I
about
think
outcomes,
and
that
and I think this, and I think it's worth pointing that it's always worth celebrating small victories,
yeah,
and it's always worth demonstrating what actually works, because I think you know because the next time someone like Andy Burnham wants to come forward and go, yeah, we can't do that, the answer, it kind of becomes even more obvious that, like, you can do that. Whether you want to do that becomes the question, you know.
yeah,
And so, in some ways, this was a very specific thing. And if you look at what he was actually arguing for, most of it was he was arguing for kind of small businesses, and technically small businesses, and to get, like, and basically allow middle class people to live comfortably, which, again, I think that was probably the strongest argument he could have made. I think that was probably, that was the argument most likely to get him the maximum Conservative MPs on his side. And again, it's also worth pointing out there was a lot of Northern Conservative MPs on Andy Burnham's side, and this was part of, and um, so yeah, so it's worth highlighting the limits of the argument he was making. Um, but it's also worth but yeah, that means that next time Boris Johnson won't be in quite such a strong position, and next time Andy Burnham wants to throw his weight around, or indeed any other metro mayor of any other place, and argue that we need a better test and trace system, for example, or a better and or a better shielding system, or more mutual aid money, or anything. Hint, hint, nudge, nudge.
yeah. We we definitely need a more robust, well, a mutual aid uh, system because it seemed to work relatively well the first time round, from by all accounts. So
I have
if
some
we
friends who
were
are
to,
involved in that. Again, there's, it, it wasn't perfect, but honestly, it was like done on a shoestring, and basically, it was a whole bunch of people getting together and doing what they could, which
So
better than nothing.
So in a word, if you're asking us what we're calling for, is more mutual aid groups, please, now. And on that bombshell, shall we call it a day?
Yep, I think so. Right. Thanks for listening, everyone. See ya.
Bye.